Hiya. Yes, my name's Niamh. I'm one of the psychological wellbeing practitioners working at Northamptonshire NHS Talking Therapies. If I could have the first slide, please. So within NHS Talking Therapies, we work within what we would call a stepped care model. So basically, this is looking at kind of giving a patient the least intensive therapy first before giving them more intensive therapy. So as a PWP, I work within step 2 of that model. So looking at supporting people with kind of mild to moderate mental health disorders. And then if need be, we can look at stepping them up to step 3, which is where our kind of cognitive behavioural therapists work. Next slide, please. So in terms of the role of the PWP then, so as a PWP, I assess and treat patients who are experiencing common mild to moderate mental health disorders. So this means working with people who are suffering from depression and then different anxiety disorders. So things like generalized anxiety, panic, phobias, agoraphobia, and all those kind of different disorders. So I'm trained in low intensity psychological interventions, which is kind of guided self-help, and it's based in cognitive behavioural therapy principles. So obviously you can treat people for anxiety disorders, depression, and then do some sleep hygiene work as well. So the main thing that we do as a PWP is you're using guided self-help tools to teach people the interventions. So we teach people things like behavioural activation for depression. So behavioural activation is very similar to what Dominic was talking about earlier, in terms of giving people the tools to assess what they're doing in the day-to-day life if they're feeling depressed, and then looking at how do we increase your pleasurable behaviours so that you're getting more out of your day and lifting your mood through your behaviours. Cognitive restructuring is another one that we look at, in terms of which is basically just thought challenging. So looking at giving people the skills to challenge negative thoughts that they might have when they're feeling depressed. Graded exposures, looking at kind of the phobia side of things. So gradually getting a person to expose themselves to that feared situation in terms of helping them understand that it might not be as scary as they think. And then worry management is the main intervention that we use for anxiety. So looking at what people are worrying about in terms of, is that a hypothetical worry or is that something that you can practically change, and kind of giving people the tools to understand the difference and then be able to identify them as well. Next slide, please. So again, just a little bit more about the role then. So in terms of how often I'm seeing patients, I see them once a fortnight. We can offer up to 8 sessions for each patient that I work with. So working first session is about 45 minutes. And then from there, they're about half an hour every 2 weeks. Most of the sessions that I'm doing at the moment are completed via telephone or over Teams. However, I'm also seeing people face-to-face 1 day a week. In terms of in these sessions, so during the sessions, we're looking at completing a medication review. So just checking in terms of their medication that's prescribed to them by the GP. Are they taking that as prescribed? Any changes like that? We'll do a risk review as well to check that they are able to keep themselves safe in between the sessions. And then a general review about how the patient is feeling, how they've been getting on with the materials over the last couple of weeks. The main thing within the sessions is looking at the guided self-help materials. So they'll be given a booklet and different worksheets in each sessions, and it's about working through that with the patient and making sure that they understand what they're needing to do outside of the sessions. So the main aim is kind of making positive improvements to their life that they can carry on with outside of sessions, and then have those tools so once they're discharged, they hopefully won't relapse. So as a PWP, I also have weekly case management supervision with my supervisor. We have monthly clinical skills, monthly action learning sets, which is basically where we just meet as a group of PWPs and talk about different cases that we've got and kind of problem solve together, which is really, really valuable because you're interacting with your colleagues and you're kind of learning as well. And then lots of continued professional development opportunities. So lots and lots of different training in different areas as well. So we can look at kind of OCD stuff and other things like that. So it's really helpful in terms of just continuing your development within kind of psychology. Next slide, please. So in terms of why do I do it then? So I'd say the main reason I do it, and I think it's probably what most people will say to you today, is you see people get better. So you see that difference from session 1 to session 8 of them improving. And that is, you can see you're making a difference in people's lives. And that is what really keeps you going. It's also a really good role within the NHS in terms of leading on to other things. So once you've done the PWP role, you can apply to be a senior PWP after about a year. There's also other opportunities in terms of kind of high intensity training. You can go on to the clinical doctorate. So it's a really good role in terms of looking at what you want to do and where you want to progress. Also, another thing for me that's really helpful within the role is at Northamptonshire Healthcare, we have flexible working patterns. So that for me means that I work until 8 p.m. on a Wednesday, so I do a long day, but then I finish at 2 p.m. on a Friday. So it gives me more time on the weekends, more time to relax. And that's something that they're really passionate about, kind of working for and with their employees. Next slide, please. So in terms of becoming a PWP then, so I actually started as an assistant psychologist. So I worked within Northamptonshire Healthcare as an assistant psychologist for about 2 years, mainly doing assessments for people who were coming into talking therapies, and then you would book them in with a PWP. Once I had done that, I applied for the PWP course, which is the low intensity cognitive behavioural therapy intervention course. I did it as a postgraduate certificate because I already had a degree in psychology. That is 1 year training, and it's a combination of university directed learning and then clinical practice. So what that means essentially is, whilst I was employed full time by Northamptonshire, I was also doing 1 day a week at university, and then I was working in the trust the other 4 days a week. So it was very fast paced. It's a very fast paced working environment, but it's really, really beneficial because you get a lot out of it. You're training and then you're putting it straight into practice the next day. And the PWP course can actually also be taken as an undergraduate course, but mostly people will take it as a postgraduate after they have done a psychology degree. Next slide, please.